My name's Angel Soliveris, and I would like to welcome you to the show, Making a Connection in Lancaster. Today we have very special guests. We have Zoe Bracci, is the Marketing and Education Coordinator for the Albright Life of Lancaster. Zoe, welcome to the show.
Good morning, Angel.
Great to have you here today. Zoe, tell us a little bit about yourself and how long have you been involved with Albright Life?
Well, I've been with Albright for 3 years as of June. We've been open for a little over 2 years now. I do have over 30 years of experience in human services, formerly working with people under 60 at United Disability Services and teaching high school.
Great. So you have plenty of experience, and I'm sure you are using all that experience at Albright Life.
Yes, I've been able to rely on all the resources I've built up in the community over all these years to let people know about this wonderful program now that's in the community to serve seniors.
Fantastic. Zoe, today we're going to discuss Albright Life and exactly what is Albright Life for those people who don't know.
Okay, well, Albright Life, Living Independently for Elders, is a program that allows seniors to age at home. We offer all the services of a nursing home while people live at home. So anything you think of that a nursing home would offer, such as medical care, therapy, prescriptions, medical equipment, supplies, anything that would be deemed medically necessary would be available through our program, as well as home care for individuals that might need help with, personal care, errands, perhaps even supervision if their primary caregiver needed to be away from the home, transportation. Yeah. Meals, we offer meals, social and recreational activities for seniors so people can stay connected to their age group friends.
Okay, great. And life, the word life in your program, what does that stand for?
Well, that's Living Independently for Elders. We are actually part of a national PACE program, but in Pennsylvania we have the PACE prescription program through the lottery. So only in Pennsylvania is this program called Life, but it is available in other states, and people can actually look at their Department of Aging for information on who their provider might be.
Okay, and what type of people are eligible for the Albright Life services?
Well, we serve seniors, so they do have to be 60 years of age or older. They have to reside in the community where the program's available. So for us, they have to live in Lancaster County, but we will be opening in Lebanon in September, so residents of Lebanon County would be eligible for that program. And they have to be determined to need nursing facility level of care. So that's done through the Office of Aging. Okay. And people could ask themselves questions about their loved one. Do they need help bathing and dressing? Do they need help with hygiene? Do they fall a lot? Do they have a lot of medical issues that require hands-on nursing or medical attention? Those are the things the Office of Aging would be looking for.
Okay, and those services are provided at the facility only, or do you provide some home care as well?
Primarily the services are offered at our facility, and we are located at 417 West Frederick Street in Lancaster. We're between Charlotte Street and Lancaster Avenue, right off of Harrisburg Pike, so people can get an idea of where our facility is. At that location, we do offer all of our medical care services and our therapy, as well as our adult day program, which is the social and recreational part of what we offer. But there is a home care component, so our center is open from 8 to 4:30, but people, of course, would need help beyond those hours. Right. So evenings, weekends, holidays, a CNA would be able to go to their home, and in some cases, if it were necessary, a nurse.
Okay. And how about as far as getting into the program, is there a waiting list for this program?
We don't have a waiting list, and hopefully we never will have a waiting list. We currently have 61 participants. We're licensed for 128 in the building on any given day. The reality is people would not necessarily come every day, so there would always be openings. And should we ever outgrow our program, we would open satellite locations in different geographical areas of the county.
Okay. And how often do your participants go to the program?
Well, that varies. That's a good question. We do individualize our care plans. So people meet with our team, our social worker, our doctor, our center manager, and along with their family and the individual themselves, they design what their plan will look like. Okay. So we do have people that come to the program 5 days a week for full days because of various reasons. Their spouse might need a break. They may live with an adult child who needs to go to work, and so for their own safety and for their care, they need to come to our program. or perhaps they have a lot of medical needs and they need to see the doctor or nurse frequently. But others come as little as 1 day a week. So again, it's personalized and determined on their needs and their family and caregiver needs.
Okay, and how long do they stay when they come?
Generally, people stay for an entire day. We're open 8 to 4:30. Now, that's staggered arrival times and staggered departure times. We do have an individual that comes half days, 2 half days a week, because physically that's what she can manage. So again, it's personalized based on needs and what the family or the support network determines.
Okay, and the process for enrollment into this program?
Well, there are 2 options. Again, because we're through Office of Aging as our assessment agency, anyone that would need services from the community for a senior or a senior themselves could call Office of Aging, and they would do an assessment for all of the Office of Aging programs. And if the assessor thought that the life program was an appropriate placement, they would give them information about our program and then either call on their behalf or the individual could call for themselves. Or ideally, they can call our life program themselves. Our number's 381-4320, and ask to talk to the intake person, who actually is Betsy Hartraft, and she will start the process. If an individual would need more support in looking for services, it would be a good idea to call us directly, because Betsy helps people through the process, even involving Office of Aging. So she gets all the paperwork done first, all the original documentation that's required by Office of Aging, and then she sets up the options assessment for the senior themselves.
Okay. And the big question, payment for the services, how does that take place?
Yes, we are a Medicaid-funded program. So if an individual is eligible for Medicaid, there's no out-of-pocket expense for our program. So we're funded by Medicaid and Medicare. So if an individual has Medicaid and Medicare, everything is available to them at no cost. Some long-term care coverage will pay for parts of our program. And then, of course, if you're outside the scope eligibility-wise for finances, you can private pay for the program.
Okay. How about private insurances and so forth?
Right. Some private insurances, that's on a case-by-case basis, because, of course, everybody's plan is different and everybody's coverage is unique to them. So it again might pay for nursing, it might pay for respite care, it might pay for adult day program or home care. Okay. Our intake person would contact the provider and make that determination based on that individual and their plan.
Okay. And what about the requirements to be able to get into a plan like this or a program like this? What are those?
Well, right now you have to be 60, although sometime later this year our age will go down to 55. You have to live in the county, and you do have to be assessed by Office of Aging. So you do have to have some skilled level of care need. You also need to have a support network in the community. Although we're available 24 hours a day, we're not, of course, in somebody's home 24 hours a day. We can staff hours at home. We can have people come to our center during the daytime hours. But the reality is you do need to have a support network in the community, whether it's a person you live with, a family member, a neighbor, someone from your church community that's available as a backup for you in time of need.
Okay.
So that would be one of the things that we do look for, that somebody isn't relying on us to fill 24 hours a day.
Okay. Now, your facility is not open 24 hours a day. It's only open day hours, is that correct?
Yes, it is only open day hours, Monday through Friday, 8 to 4:30. We are closed on all the major holidays, and we are closed weekends. But we do have, of course, our home care aides that are staffing hours during the time the center's closed. And then, of course, we have nurses that are available. One of the nice things about our program, Angel, is that our nurses that work in our program are also the nurses that are available during our after hours. Oh, okay. So if you, as a caregiver or a senior themselves, has a fear, a concern, a question, and they call our program, they get a nurse that they know because they've already dealt with them in the program during the daytime hours. Or you may have attended a care plan meeting as the son of somebody that attends our program. So you're familiar with that person that you're now talking with on the phone. And they know your situation, they know your family member, they know their medications, their health history, their issues, so they're available often to resolve problems on the phone. But if it's necessary, they also can come to an individual's home after hours and do what's needed.
That's great, and I think that's a big plus for a patient or a senior to be able to deal with somebody that they already know, and that's great.
Yes.
What type of services do you provide at the center while the patients, do you call them, what do you call them, patients, participants?
We actually refer to our individuals as participants.
Okay. What types of services do they get while they're there during the day?
If somebody comes in during the day, a typical day at Albright Life would look, we have an adult day program, so people arrive, and again, they start at 8 o'clock, and by about 9:45 or 10, everyone is there that's coming for the day, unless they have an appointment out or for whatever reason they're coming later. They have coffee, they have social time, and then there's activities that are scheduled for the day, typical to what you would see in a nursing facility, devotions, crafts, music. We bring in speakers, we bring in entertainment. Then there's games or exercise or dance, a lot of activity to get people moving and interacting, keeps the brain stimulated, it keeps people physically motivated. While they're in the program, they're leaving the program to go down for therapy. So maybe they have a half-hour session with the occupational therapist. Maybe then they come back up and they do an activity and they go down for physical therapy. And they come back up and the nurse has them come down to check their sugar, to make sure that their insulin levels are correct, to change a dressing, to visit with the doctor, to talk to their social worker. The luxury of our program is we pick people up at home, we provide transportation, we bring them in, and everything that they might need is under one umbrella. It's all there, it's in one location. So they get a multiple choice of activities and services while they're there for the day. And then at the end of the day, they get to go back home, which is really ultimately where people want to be.
That's great. Yeah, it sounds like a busy day in there.
It is a busy day.
Great. Tell us, so basically that's a typical day for most
people.
Most participants that go there. The transportation system that you guys use, tell us about that, and I'm sure you make allowances for walkers, wheelchairs. No bedridden patients go there, or participants, right?
Well, we have a variety of people that attend our program at all levels of physical need.
Okay.
So we do have people that walk, we have people that use walkers, we have people that are in wheelchairs that can propel their wheelchairs themselves, people that rely on someone else to move them.
Okay.
So yes, our vans are equipped to serve individuals. They all have a lift, so people can be accommodated regardless of what their level of physical ability is. We do have a variety of types of vehicles. We serve the entire county, so we have buses that can carry larger numbers of people. Then we have minivans and cars. So, depending on where an individual lives and what transportation route they're on, would determine what vehicle they're in. The nice thing about our program is transportation is under our program. So our drivers work for us.
Right.
So we're not contracting out for our transportation service. Our drivers are part of our care team. So if they go to somebody's home and there's a red flag, maybe the person didn't answer the door and we know that they're supposed to be there, or they arrive and the individuals may be confused or not feeling well, the driver can call right into the clinic and say, this person isn't feeling well, and what do you want me to do? Do they need to come in? And right away they can come in and see the doctor, they can see the nurse, they can have that need addressed, or maybe they need to have an aide come to their home because there's an issue. So the fact that the drivers are part of the care team is important because, you're sending perhaps your father with this person that's at your door, and you want to know that your father's going to be safe and well cared for during that trip to our center.
So you guys give the drivers additional training?
Absolutely. There's a training program that they must go through with our insurance company, and then they actually do hands-on driving, shadowing another driver, and then they're observed driving before they're ever left out on a route on their own.
Okay, great. How about bilingual services? Do you have anybody on your staff that's bilingual in the nursing staff?
We do have bilingual staff in our center. So the aides that are responsible for the direct care of individuals that would be attending every day, and the most closely connected to our participants are bilingual.
Okay, great. I do want to ask you something else. Do you take any of your participants out of your facility to events or anything like that? Or
We do. We try to do events. We, as I said, have 61 people now, so we try to keep the events smaller scale because it would be very obvious to be traveling with 61 individuals, and not everybody would care to do everything. So it's an opportunity for people to sign up for something if it's of interest. We've done shopping trips. We go to the Barnstormers baseball game. We've gone out to eat. Oftentimes, participants will have a niche area of something that they're interested in, and they'll suggest an activity. We also like to bring things in, speakers or musicians or an acting group or a ballet class that will come in and they'll do a performance at the center, and then everybody gets to enjoy that regardless of whether they do well traveling or not. It's easier to bring things in, and then everybody gets to have that experience.
Another question I had was inpatient. In the Lancaster area, you don't have any inpatient like apartments or the cottages that you have in other areas.
Right.
Is there any plans in the future to have something like that more local?
Not connected to the LIFE program. We do work very closely with the housing providers in Lancaster, HDC, Community Basics, private landlords, because if they have a tenant that's doing very well for them, maybe has been there a long time, and now their health is starting to decline, and they're noticing, that they need more help, more services to keep them there, but they've been a good tenant. It serves them well to have that person remain in their housing. So the whole focus of our program is to keep people where they live, not to bring them into a residential setting. So we would enhance services for that individual as their needs increased so they could stay where they already were. So it's a nice partnership with housing providers because they get to keep a long-time tenant, resident in place. And we get to be able to serve them where they live so that they can stay there safely.
Okay, so how about if you have, let's say, a landlord that is not willing to adjust his apartment, make it more handicap accessible and stuff. Do you help that participant in your program possibly find another place?
We have, if people are already in our program and they need to make other housing arrangements, our social work staff would work with them on that and access the other housing providers in the county as opposed to us becoming a housing provider.
Okay, great. So if you have an opportunity here to tell our viewers how to contact someone who might be interested in your program. What would you say, who should they contact and where and when?
You can call our office anytime during our normal business hours of 8 to 4:30. You would call 381-4320 and ask for Betsy. She'll start the process. You can call me at that same number. Again, I'm Zoe, and we can answer questions. If you're not sure about us, give us a call, come out and look at us. We love to have visitors check out our program because seeing's believing. When you talk about nursing home services, depending on people's experience with a nursing home, colors what their impression of our program might be. But when you come in and you see people happy and they're engaged in activities, and maybe they've been home a long time by themselves, and it's hard for them to get out because they don't feel well. It's hard to travel if you don't have transportation, and they can come in and they get meals and they do fun activities and they make friends. Knowing they're going home, emotionally they feel better, physically they get stronger, and we see people adjust very well to our program. So calling us and coming out for a tour would be a wonderful way to start the process, see if it's right for you, see if it's right for a family member.
Yeah, and I've toured a facility several times, and I'm really impressed with the way it's run, and everybody in there, you look around and they're a lot happier than you see them in a nursing home. I don't know if you've walked into a nursing home lately, but sometimes it can get pretty depressing.
They are. Not that there isn't a time and place. We serve individuals in our program for as long as possible at home. But there might come a time when an individual would go to a nursing facility. Once they're in our program, if they choose to stay in our program and have reached that point, we continue to serve them even though now they may transition from home to a nursing facility. If I have dementia and my husband passes away and I don't have anyone else to look after me while I'm home, at that point I might have to go to a nursing facility. But Albright's social workers and doctor would continue to advocate for me even though I no longer live at home.
Okay, so if that person ends up in a nursing home, are you still able to provide your services for that participant that's in your program?
Yes, in conjunction with the services that would now be offered at the nursing facility. They would continue to stay as an Albright Life participant,
All right.
unless they chose to leave.
Yeah. Okay. Well, thank you. Because the thing is, there's so many elderly that they don't want to leave their homes.
Right.
And they only go to a nursing home unwillingly in most cases.
Yes.
I know that was the experience with my mom when she needed the services. Well, Zoe, thank you very much for being here today. And for helping us to make this connection in Lancaster.
Thank you, Angel. It's I love our program, and I appreciate the opportunity to let people know about us.
Fantastic. I also wanted to say we're going to try to offer this program into the Latino senior centers that we have here in Lancaster.
Yes.
You know, SACA has one of the busiest senior centers in Lancaster, and I'm trying to get all that information disseminated in the center. Have you had the opportunity to tour our center yet?
Oh yes, I've been to the senior center a number of times. I have the privilege of being part of the Wednesday SACA market. I was there last year, and I look forward to being there in the beginning of August this year. So again, people can come out and pick up information at that location. I think we're there on August 10th. And we're working with Yamaras from the Senior Center to do some outreach, again, just letting people know. It takes a long time for people to be comfortable with the change, and we understand that. We see that, you know, it's an admission for seniors to say, yes, I need help. Right. You know, we fight very hard to stay independent as long as possible. And when you have to admit that there's a loss, and yes, maybe I do need help with getting dressed, or I do need help to get a bath, or to say to somebody, wow, I have so many medications, I can't keep them straight, and I have so many doctors that I need to go to, and I get confused. People are very private about that information and don't like to say to someone, I need help. So we like people to know about us and, you know, maybe gradually get comfortable with our program and services, and then, you know, realize that, yes, it is going to help me stay home. So that's the added bonus, because people do want to be home.
Yeah. And I've seen a lot of your brochures, and now you have them printed up in Spanish.
Yes,
as well.
we do.
I'm not sure what our supply is at the center, but I want to make sure that we get some of those.
Yes, that'd be wonderful.
Pass them out.
We have some new posters too, so I'll make sure that we get those to the center so that they can be posted, and you know, people see it, and it might not be something you need today. But it's good to know what services are available, so when the time comes that you need help, you know what's there, because oftentimes people need help right after a crisis. You know, they've had a health crisis, or they've had a series of health crises, and now they're saying, oh my gosh, I don't know if I can continue to be home because I can't do this anymore. And now they're making a decision quickly, as opposed to being able to research what options are out there.
And sometimes it's a family member that has taken care of this individual for so long, and they get tired, or they have to work, they have to travel, and it's difficult for the family members. So that's a great service, I think.
Yes.
That you guys provide.
That's a good point about the family members. One of the bonuses of our program is that it does relieve primary caregivers. I cared for my father, and you spoke about your mother. It does take a toll, especially when you have to work and you have children and you have other responsibilities, and you may have to care for your loved one at their home. So now you're going back and forth between two houses, and you're making sure they have meals. You're taking off work to take mom to the doctor, and your employer is saying, you know, this has to change, and you're feeling all this stress. And maybe as your mom or dad's health is getting worse, your stress is going up, and now it's impacting your health and your quality of life. So the fact that we can help you with that, because we help with the medical, and we make sure that mom and dad are safe, and you have help at home. Even if mom lives with you, you can still get help at home. So, you know, thinking of it from a caregiver point of view, it's also a good service.
Absolutely. Well, thank you again, Zoe. I really appreciate you being here and clearing all that up for us. Unfortunately, we're out of time, as usual. But I would like to thank our viewers for watching, and you know, understand it by you watching and these programs. It really helps us to bring to light a lot of the information that you guys request from us. So please stay tuned for more interesting topics and guests in the weeks ahead. Thank you.